Hi, today we'll discuss about puerperium. Puerperium is the period after childbirth. It's nowadays called as fourth trimester. The difference is fourth trimester is a period following childbirth and up till 12 weeks after that. But in puerperium, it takes account till 4 to 6 weeks after delivery. The postnatal visit recommended by ACOGs, initial visit is in the third week and final visit in the 12th week. Between this time, depending on the need. But what is the postnatal visit recommended by Government of India is four visits. First day, third day, seventh day, and 6 weeks after delivery. What are the anatomical and physiological changes? We'll see organ change and important points. The organ uterus immediately after delivery is at the level of umbilicus and has the consistency of cricket ball. The fundal height decreases by 1 centimeter per day, which is equal to 1 finger breadth per day. So 2 days after delivery, it will be a finger breadth, 2 finger breadth below the umbilicus, and the weight of the uterus after delivery is 1000 grams. After 1 week, the level at which the uterus will be in between the umbilicus and pubic symphysis, and the weight is 500 grams. After 2 weeks, it is not palpable, and the weight is 300 grams. By 4 weeks, the involution is complete, and the weight is 100 grams. The process of involution is due to decrease in size of the muscle fiber and not the muscle number. Sonographically, uterus and endometrium return to the pre-pregnancy size by 8 weeks. Involution is faster in nulliparous female compared to multiparous females. Lower uterine segment contraction becomes isthmus. The cervix, which is 10 centimeter dilated after delivery, remains 2 to 3 centimeters dilated for few days after delivery and then contracts. Coming to the external loss, in case of multiparous female, the external loss is a transverse slit, but in case of nulliparous, it is a pinpoint or circular. The endometrial changes during pregnancy, placenta produces progesterone, which supports the endometrium. But after delivery, the placenta is delivered, there is decrease in progesterone. So the support to the decidua is lost. So decidua will shed in the form of lochia. Lochia, as I said, is the shedding of decidua after delivery. What are the components of lochia? Decidua, blood, leukocytes, and exudates. The sequence of lochia is lochia rubra, which is red discharge, followed by lochia serosa from the fourth day after delivery, till finally lochia alba. It starts at the 10th day after delivery. Average duration of lochia discharge is 24 to 36 days. Placental site involution. It takes 6 weeks. Immediately after delivery, the placental site is at the size of the palm, but by the end of the second week, it is 3 to 4 centimeter in diameter. The ovarian function in partially or not breastfeeding female, the menstruation returns by 6 to 8 weeks and ovulation occurs at a mean of 7 weeks, earliest at 28 days. The contraception is advised by 3 weeks after delivery. In breastfeeding females, ovulation and menstruation are delayed. Contraception is advised by 3 months after delivery. It is called as rule of 3. 3 weeks in non-breastfeeding females or partially breastfeeding females, 3 months in breastfeeding females. The risk of pregnancy in breastfeeding females is 4% per year. So all of the following is normal in case of female after delivery. Marked leukocytosis normal, marked thrombocytosis normal, increase in granulocytes, relative lymphopenia, absolute eosinophilia, hemoglobin and hematocrit decrease, increase in fibrinogen of pregnancy is maintained in first week of postpartum. During pregnancy, sodium and potassium retention occurs, which leads to postpartum diuresis that leads to 2 to 3 kg of weight loss. The following return to normal. Blood volume 1 week after delivery, cardiac output 10 days after delivery. In the initial 24 to 48 hours, it is elevated. GFR by 2 weeks, dilated ureter and renal pelvis by 2 to 8 weeks. Urinary retention is common. Immediately after delivery, weight loss is 5 to 6 kgs and subsequent weight loss is 2 to 3 kgs. As I said, it will be due to postpartum diuresis. A multiparous female after delivery complains of pain in abdomen, and the pain is similar to uterine contraction increased during breastfeeding. It is called as after pains due to uterine contraction occurs at intervals after delivery. Seen in multiparous females, it increases with suckling of the baby due to release of oxytocin. It decreases in intensity and becomes mild by day 3. Female with postpartum uterine infection, the pains are severe and persistent. During postnatal visit on day 7, after delivery, uterus was felt 2 finger breadth below the umbilicus. On day 7, the patient complains of excessive uterine bleeding and ultrasound was advised, which showed enlarged uterus with tubular hypoechoic areas in myometrium. The diagnosis is subinvolution. The patient complains of excessive uterine bleeding or prolonged lochia. In bimanual examination, the uterus is bigger than expected. Due to incompletely remodeled spiral artery is the cause, or retained placental fragments or infection. The differential diagnosis is retained placental products. Investigation of choice is pelvic ultrasound. If thick endometrium with vascularity in it is present, then it is retained placental products. If enlarged uterus with tubular hypoechoic areas in myometrium is present, then it is neovascularization and dilated vessels, subinvolution due to incomplete remodeling of the spiral arteries. You will manage using uterotonics. But in case of retained placental products, if you do curettage, there is a risk of developing Asherman syndrome. Monitoring in postpartum period. All females after delivery should be monitored for 2 hours every 15 minutes. Intermittent assessment of uterine tone is checked and BPN pulse rate is checked. Temperature every 4 hours for first 8 hours. Then after every 8 hours. Female is orally allowed after vaginal delivery is 2 hours. Female should void within 4 hours after vaginal delivery. If not, do ultrasound. If the residual volume of urine is greater than 200 ml, then the patient can't void, then catheterize the patient for 24 hours. Discharge. In case of uncomplicated vaginal delivery, you can discharge 48 hours after delivery. In case of C-section, you have to discharge 96 hours after C-section. Sexual activity can be resumed by 2 weeks of after delivery. So, what are the contraindications of breastfeeding? In case of infant with galactosemia, in case of mother having drug abuse and uncontrolled alcoholic habits, active or untreated TB infection, active herpes infection with lesion on breast, undergoing carcinoma breast treatment, the mother is using drugs like cyclophosphamide, methotrexate, cyclosporin, doxorubicin, and mycophenolate. Breastfeeding is not contraindicated in COVID-19 infection, HIV positive cases, hepatitis B positive cases, provided the infant is received immunoprophylaxis, herpes simplex infection if there is no breast lesion. After gadolinium MRI. What is puerperal pyrexia? So it is a oral temperature that is greater than or equal to 38 degrees Celsius or 100.4 degree Fahrenheit on two occasions within first 10 days of delivery, excluding the first 24 hours. Most common risk factor or the most important risk factor is C-section. A single dose of operative antibiotics is recommended in all females of LSES. Coming to the pathogenesis, in cervix and vagina, the polymicrobials are there, the microorganisms which will be causing the infection. The risk factor is C-section, premature rupture of membrane, prolonged labor, and multiple vaginal examination. Most common infection of the placental site, which is last to involute or wound infection in case of uterine incision, which will lead to endometritis, fever, tachycardia with parallel rise of fever, and midline lower abdominal pain and uterine tenderness. It will affect the myometrium, parametrium, peritoneum or pelvis, and it spreads to bloodstream and cause septicemia. In case of investigation, you will see WBC will be elevated, but It is also normal during puerperium. In case of blood culture, depending upon the patient condition, you have to do the investigation. Endometrial culture is not done. Management in case of mild endometritis following vaginal delivery, you have to do give oral amoxiclav plus metronidazole. Infection following C-section, you have to give IV ampicillin and gentamicin. When the patient is afebrile for 24 hours, then you can switch to oral. Most persistent fever after childbirth are caused by genital tract infection. First 24 hours are excluded generally because of low-grade fever in the first 24 hours resolves by itself. But if the fever is greater than or equal to 39 degrees Celsius within the first 24 hours, then the culprit is group A streptococcus infection. In case of non-breastfeeding females, there may be fever due to breast engorgement, that is called as breast fever. It is rarely crosses 39 degrees Celsius and it lasts less than 24 hours. Obstetric neuropathy. Patient after vaginal delivery, if she complains of burning sensation, numbness, tingling over the upper outer thigh and lateral hip pain, then the nerve involved is lateral cutaneous nerve of thigh. It is the most common nerve injured during vaginal delivery. It contains only sensory fibers, no motor fibers are involved, so there is no motor deficit. If she complains of weakness of quadriceps, sparing the adductor, sensory loss over the anterior and medial thigh, then femoral nerve is involved. It is the second most common nerve injured during vaginal delivery. If she complains of food drop, then the nerve injured is peroneal nerve. It is due to prolonged squatting or due to palmar pressure during fundal pressure. Most common nerve injured after C-section is ilioinguinal nerve and iliohypogastric nerve. Thank you.